heart disease and realistic protein needs. When people find themselves facing chronic illness, they may also find themselves dealing with lifestyle changes, including the way that they look at food and exercise. They may have to take a variety of medications or even face surgery. While protein is a vital part of any healthy diet, it is even more important for anyone who is facing a serious illness. Protein is important for the immune system as well as for the regulation of blood pressure. Protein is also a great way to deal with a change of eating habits, making it easier to eat healthy foods without overdoing it and without feeling like you are starving in the process. Protein plays a number of roles in heart disease, with certain types of proteins affecting heart health more than others. If you have heart disease, it is very important to follow all of your doctor's guidelines for activity, medication and nutrition. Because some proteins positively affect the heart, a doctor might suggest that you get more of these or that you replace protein choices that are not as healthy with better choices. The prevalence of heart disease in the United States. Heart disease kills over 16 million people all around the world every year and is the cause of up to 30% of all deaths annually. In the United States, heart disease and strokes cause even more deaths, causing up to 40% of all adult deaths each year. Natural news. Research links soy protein with heart health. November 18, 2006, there are a number of risk factors that increase your chance of developing heart disease, including obesity, high blood pressure, smoking, diabetes, insufficient estrogen in women, sedentary lifestyle. In the past, men were affected by heart disease more often. However, in recent years the rate at which women are facing heart disease has increased dramatically. Source: Christine Amra. The New A to Z of Women's Health, 5th edition. Checkmark Books, New York, New York, 2005. A negative protein to consider. C-reactive protein is an acute phase protein which can increase symptoms of systemic infection. The protein occurs in larger amounts in response to the inflammation in the body caused by injury or infection. The American Heart Association and the Centers for Disease Control and Prevention suggest that additional testing be done if there are a number of risk factors in place. An elevated level of CRP can predict recurrent heart disease, stroke and the increased risk of death. The higher the levels of this protein in patients who have been diagnosed with unstable angina or who have had previous heart attack, the higher the risk of death. The risk of heart attack in those who have tested in the upper third for CRP is twice that than for the lower third. Positive protein benefits. A number of studies have been done that show certain types of protein can be very beneficial for heart health. One such study has shown that a set combination of milk proteins may reduce salt-induced increase in blood pressure, which in turn may increase the risk for heart disease. These milk tripeptides can result in a nearly 5-point drop in systolic numbers and nearly 3 points in diastolic. In addition to heart benefits from milk proteins, soy protein has been shown to have valuable benefits as well, lowering blood cholesterol as much as 9 points and lower blood pressure as well. Whey protein, a derivative of milk, may improve the function of blood vessels in otherwise healthy people as well. Protein supplements and heart health. There are several types of protein supplements that can be useful to prevent heart disease and can be used after the problem has been diagnosed, as long as the doctor agrees to it. Whey and soy protein are both beneficial and can be found in protein powders that are easy to use. Both are available as a concentrate, or as an isolate which has higher protein content but may be easier to digest and cause fewer problems with allergic reaction. Both protein types can be used in the vegetarian diet but only soy is acceptable for a vegan lifestyle. Another protein supplement is ProfectR, which is a small protein shot that delivers 25 grams of protein per 100 calorie serving. Available in a variety of flavors, ProfectR can be frozen, boiled and mixed with other foods or beverages for easier use. Every serving delivers a number of vitamins but 0 fat and 0 carbohydrates. Heart health and protein. A case study. Jake has a number of risk factors for heart disease including smoking, obesity and high blood pressure. His latest blood tests revealed that he has high blood cholesterol and is borderline diabetic as well. Because of his current health status, his doctor orders additional testing including the C-reactive protein level. When the results come back, he finds that his CRP level is 4, which is high. This result puts him at increased risk for heart attack, twice that of a person with a lower test score. The doctor suggests that Jake start a walking program and that he learn what makes a healthier diet. Of course, he tells Jake that he should stop smoking. Finally, the doctor suggests that he increase his protein intake slightly. Jake's doctor introduces him to ProfectR, which will be easy for him to use and available in enough flavors that he never has to be bored with this supplement choice. Because it has only 100 calories, ProfectR will be a good between-meal snack, helping Jake to feel full without feeling deprived, allowing him to eat less than he has previously. This reduced eating and increased activity level will help him to slowly and safely lose weight, helping him to care for his heart,